Every person is different, and as patients, each has unique healthcare concerns and needs. But one thing they all share is that they deserve your individualized attention and care. Many patients today, an estimated 42% of adults in the United States, also unfortunately share a clinical diagnosis of obesity, a chronic disease which plays a role in the development of multiple challenging physical and emotional conditions. As a nurse practitioner, you are in a unique position to help these patients manage the disease of obesity and its long-term effects. Obesity is a health epidemic. Let's review some of the specifics of how obesity is impacting our society today. The CDC measures that 42.4% of U.S. adults suffer from obesity and have a BMI of 30 or higher. Studies have shown that there are more than 50 comorbidities of obesity, the most prevalent of which are type 2 diabetes, hypertension, heart disease, stroke, and sleep apnea. Without meaningful intervention, healthcare costs associated with obesity are expected to reach over $957 billion by the year 2030. Most recently, COVID-19 has been revealed to have the severest impact on patients suffering from obesity. The nature of obesity as both chronic disease and preventive care calls for the skills and talents of nurse practitioners. The American Medical Association declared obesity a chronic disease in 2013. Nurse practitioners possess the key qualities for managing the chronic disease of obesity for high-risk patients, including the necessary training for primary care and medication management, empathy, and effective consultation. Obesity care can also focus on prevention and wellness, depending upon your patient. Let's take a look at the guidelines for the screening of and follow-up care for patients with obesity. The screening guidelines are very simple. They state that all adults in the U.S. should be screened for obesity annually. Follow-up care guidelines are determined by body mass index and the presentation of additional risk factors such as hypertension, dyslipidemia, and abnormal blood glucose levels. For patients not deemed to be high risk, it's recommended that you individualize the decision to provide or refer to behavioral counseling. For patients determined to be high risk, as indicated by the red boxes here, the guidelines strongly recommend that you provide or refer them to intensive behavioral counseling. The clinical protocols for intensive behavioral counseling for patients deemed high risk are also very straightforward. It should be noted that these are guidelines issued for insurance coverage. They do not take into account any other treatment factors such as nutritional therapy or medications. During the first month, you should schedule one face-to-face visit each week. During months 2 through 6, schedule one face-to-face visit every other week. During months 7 through 12, schedule one face-to-face visit every month, but only if the beneficiary meets the 3-kilogram weight loss requirement at 6 months. The number one reason for managing the disease of obesity is, of course, the health of your patients. Under your care, patients can often decrease or entirely eliminate medications for comorbid conditions through successful obesity care management. As a result of less chronic disease, your patients will feel more energy and confidence. And happy, healthier patients lead to higher professional satisfaction and financial reward. As a practice, obesity medicine offers stability and sustainability through a mix of insurance-based and cash-based revenues. With updated 2021 guidelines for E&M Coding recognizing time-based elements, providers will benefit from the time spent for obesity screening, managing the chronic disease of obesity, and counseling high-risk patients. Nutritional therapy and related products offer the opportunity for cash-based revenue generation. Long-term weight maintenance services and annual obesity screenings offer your practice longevity. There's no need to start from scratch when you decide to manage the disease of obesity in your practice. When evaluating obesity care solutions, here are the essentials to look for. It must have evidence-based clinical protocols with proven patient outcomes. It must offer a solid practice structure complete with workflow, necessary forms, and documentation. It must have a technology platform to facilitate patient care and administrative requirements. And it also must have clinical and practice management provider and staff training. The clinical program itself should be highly structured and provide you with the turnkey resources and services to support the patient continuum of care. This includes a framework for prescribing nutritional options to make it easier for patients to succeed, and guidance for obesity medications if appropriate. Its system should support USPSTF and CMS guidelines for obesity screening, managing the chronic disease of obesity, and intensive behavioral counseling, including the generation of documentation for your patient records. You should be able to produce safe and effective obesity outcomes quickly, which will drive patient engagement and new patient referrals. The system should be very repeatable and predictable, which gives your patients even more confidence in your care. Now is the perfect time to start managing the disease of obesity in your practice and have a positive impact on your high-risk patients who suffer from this chronic disease. Contact us today to see how easy, affordable, and rewarding it can be.